Hello guys, good morning. It is happy Sunday morning and welcome to my YouTube channel. I am Dr. Nyamohanga. So today, being a Sunday, we just want to just felt I should talk about something that a very common symptom, and I just want us to just talk about it in brief and get to know when to seek medical attention because it's a very simple medical condition, but sometimes it can actually complicate. So we are well aware of this medical condition called urinary tract infection. It is uh, it affects both male and female, but more commonly in the female. Why? Because we know very well that the female reproductive system, or you call more especially in regards to this topic, would say the urinary tract system is known to be very short. The urethra in female is very short, and that explains why they get these recurrent UTIs. So urinary tract infection, commonly referred to as UTI, is uh, most people present to the hospital with symptoms that are commonly known to all of us. One, to either present with for the female to present with a vaginal itchiness. They may also complain of vaginal discharge. Some will only have some discomfort that they would call, they would refer to as pain or discomfort in passing urine. Some would say that at the end of passing urine, they feel a bit uncomfortable, and that is usually one symptom that really makes them uncomfortable and makes them make it a reason for them to visit the hospital. So about the men will not present to the hospital with those kind of symptoms because we know very well that the health seeking behavior of men is very poor, and they come to the hospital when it's really bad, and at that point then it's something that would be very obvious for them to just visit the hospital. So like we said, we have different, we can categorize urinary tract infections in different we can either say that we have a simple urinary tract infections or complicated. But as like we have said, complicated urinary tract infection will definitely have will come as a result of neglecting the simple urinary tract infection, because if you delay in seeking medical health care, then definitely it's going to complicate. So but mainly the main classification is usually the lower and the upper urinary tract infection, because we say lower urinary tract infection will affect the bladder and the urethra. So patients will present with either the burning sensation in passing urine, the discharge like we have already said, some discomfort on the upper part of the what we call it the suprapubic area, that is slightly below the umbilicus region, and the upper urinary tract infection. Now that will most of the times is as a result of that is results from neglecting the simple, or we call the lower urinary tract infection, will affect the ureters all the way up to the kidneys. And most of the times, this kind of infection will present with other constitutional symptoms like fever. Patient will present with generalized body malaise, fatigue, weakness. They may present with vomiting, and there's what you call the lumbar or the loin tenderness. There's a lot of pain around that region because that's where we know the kidneys are located. So this kind of infection would result to the swelling or the ballooning of the ureters, and therefore this will need more of an inpatient kind of management that then will mean that these patients are going to be admitted and are going to be under intravenous antibiotics, and therefore even the duration of treatment is quite long compared to the simple urinary tract infection. So what happens when these patients visit our clinics? Then when you come to the hospital with these kind of symptoms, from the history we already know what kind of tests to do, because then it means we need to run a urine test to be able to get them to understand exactly to what extent this infection is. In the urine, there are so many things that we look at. There are some, we will have evidence of bacterial infection in them. We'll have evidence of either blood. Sometimes we'll just see change in color that would signify some impurities in the urine. Then I would also have to check the pH of the urine. Remember, the more acidic the urine is, sometimes we even present with a lot of discomfort passing urine without necessarily having the bacteria in there. And so then, depending again on how the patient presents, we will see if it's necessary to do an ultrasound. Remember, the ultrasound in this case is supposed to check on the the urinary tract system. So it's going to check mainly the bladder. Is there anything significant to report about the bladder, the ureters, and also the kidneys? And that therefore will explain on why or justify why we need to admit this patient for management of what we call the upper urinary tract infection, or we call complicated urinary tract infection, or acute pyelonephritis. So, like I said earlier, when these patients come after doing the basic urine test, what you you will most likely hear the medical practitioners call urine analysis. Then you have a diagnosis. Once you have a diagnosis and it's certain that this is a urinary tract infection, then you have to decide on the modality of treatment. Like I have said, most of these urinary tract infections respond well to the oral antibiotics, and there are quite a number of oral antibiotics. But remember again, the most important thing again that I forgot to mention is we say that urinary tract infection is common in the females, but remember it's more common again even in other conditions like pregnancy, patients who have whose immunity is compromised, either with HIV/AIDS, patients with kidney problems, patients with some form of cancers, patients who are on medication like steroids. These are known to lower the immunity, and therefore they are more prone to getting these urinary tract infections. Then we would actually have this kind of patients present with a recurrent form of urinary tract infection. So remember to stratify that we stratify our patients well to determine the kind of antibiotics we're going to give. So, like I said, on the mothers who come who are pregnant and have urinary tract infection, then we know that we have these drugs that are very safe in pregnancy that we need to give, and that's why we discourage over-the-counter pre-medication. We ask that anytime you have this kind of discomfort, you need to go to the hospital, be assessed first, and when the diagnosis is made, you're going to be given the right antibiotic that is very safe for you and the baby. So most of the times, these simple urinary tract infections will respond to antibiotics within 3 to 5 days, unless then we have this kind of complicated urinary tract infection that require more prolonged period of antibiotics. But again, there's other times then we say we also advocate for more preventive kind of medicine. How do we prevent? How do we ensure that we don't get this kind of recurrent urinary tract infection? We do that by ensuring that one, we observe good toilet hygiene behavior.